Good morning and welcome to the 10th annual Go Red for Native Women Heart Health Summit with our ongoing theme of Drum to the Beat of a Healthy Heart. Though we cannot be together in person, I hope that you enjoy this digital experience. My name is Shannon Flagg. I'm Zuni Edgewater born for Towering House Clan, and I'm Dene. I'm very honored to be representing the planning committee of this significant and annual event. I would love to start off by encouraging everyone to say, as you are in the chat, saying hello by typing in your name and where you're joining us from today. I do see a few. Nettie Scott from Laguna Pueblo, Susan Gaines from Chickasaw Nation. I also see Anita Toya from Jemez Pueblo, and then Pauline Arnell from Cherokee. Everyone is chiming in, so please continue to do so, and thank you. On behalf of the American Heart Association, we are so thrilled that you can join us today. To begin, we are honored to have Shaye Lucero to offer our opening blessing. I'd just like to say a few words about Shaye also. Shaye is born and raised on the reservations of the Pueblos of Acoma and Laguna. In 2008, Shaye graduated from the University of New Mexico with a Bachelor of Science degree in biology and a minor in chemistry. Upon graduating, Shaye became an entrepreneur with the purchase of a floral shop. As owner of Earth and Floral Sky Designs, Shaye learned the art of floristry to eventually become the main floral designer of Earth and Sky. She is always learning floral design techniques to create her own floral style with Native American elements, and has received accolades within the international florist industry. Shaye is also keeper of the medicinal plants of Acoma and Laguna. She began studying Pueblo traditional medicinal plants when she was 13 years old. She also published a book on medicinal plants, and that was in 1997. In 2005, Shaye received a certificate in traditional Mexican healing from 2 universities in Mexico and at UNM. In 2018, at the age of 44, Shaye survived a STEMI heart attack of the left anterior descending artery, also known as the widowmaker. She had 100% blockage and required immediate surgery for the placement of a stent. Shaye was born with a hole in her heart and was diagnosed with supraventricular tachycardia, with Parkinson's, White syndrome, when she was 14 years old. As a lifelong patient of cardiology, she learned to listen to her heart and the symptoms. By paying attention to her body, she responded to the heart attack within 20 minutes, which saved her life. The survival rate of a widowmaker is 12% for men. It's 9.6% for women. This past Wednesday, Shaye was honored with a Red Dress Award by the American Heart Association of New Mexico at the Go Red for Women luncheon. The first place award was given to her for her commitment to heart health. It is an honor to welcome Shaye Lucero. Let's all give a hand to Shaye.
Thank you, Shannon. Guadzi Haupa. My name is Shaye Lucero. I am from the Pueblos of Acoma and Laguna, Haku e Kawek. I am a daughter, a sister, a partner, a mom, an aunt, and I will be singing the blessing in English like my late father, Stanley Lucero, used to. Gatsinagupishtaya and Naya Tsichinaku. We call to you on the land of the indigenous Turtle Island people, particularly the land of the Pueblo, Navajo, and Apache, to provide continued health, protection, and strength as we walk on this earth. Those present are here to promote better heart health for Native women. Some of us are survivors, patients, advocates, but we are all here to make sure our Native women maintain heart health so these hearts can take care of our communities as matriarchs. The pandemic has made our world come to a huge slowdown. It had also become a time of reflection. It was also a time of illness and death. And we want to ask you, Creator, to bring comfort to all who are grieving. Some of us are only able to gather virtually, and hopefully we will be able to gather together in this event in person next year. And some of us may have empty spaces in our families and communities, but please, Creator, bring love, light, and peace to all. And Creator, please remind us to remember love, friendship, and respect as we all work together. We are all different, trying to do our own thing, living life the best way we know how, but also working so we don't get marks on our hands. Please, Creator, guide us to be as good humans as possible. Tawa e Dewey Shots, and thank you for allowing me this honor.
Thank you, Shay. And now I would like to introduce a very special MC that is going to lead us throughout our time together. She is a familiar face to many New Mexicans, as well as those who have attended our past events. Royale Day is a television news anchor with more than 20 years of experience in journalism. Currently, she's the morning anchor of KOAT TV, a place she's worked at for more than 14 years. During her time at KOAT, she's actually won numerous awards, including 3 Emmys. She's an enrolled member of the San Ildefonso Pueblo. Royale lives in Albuquerque with her husband and 2 young children. Royale, welcome to the virtual stage.
Well, thank you, Shannon. Hopefully everybody can hear me okay. I'm honored to be here and I'm seeing this event. I've done it numerous times and I always look forward to it every single year. What I love the most about this event is just celebrating women. I think we're all the ultimate multitaskers. We take care of so many people. And if I always hear a common theme in these events is that as women, sometimes we put our health last and we're just busy taking care of our families. And so I always appreciate reminders. I know I went to the luncheon earlier this week where Shai won her award and they gave us these stickers and they say, I take care of my beautiful heart. And I thought that was a good reminder for all of us to try and take some moments to take care of our heart health. So I'm so happy to be here with you guys. It's my honor to help this event and to talk with all of you and to see all of you and also learn a little bit more about how to take better care of myself. I just want to take a moment to thank all of our supporters and collaborators for helping this event. So a big thank you today to Western Sky Community Care, Indian Health Service, the Albuquerque area, Native Health Initiative, Running Medicine, Vitality, NAPR, CARES Community Health, KOAT, Action 7 News, and of course, all the amazing planning committee members and presenters who helped put on this event today. Heart disease is the #1 killer of women, and the numbers are even higher for Native American women. Native American women develop heart disease about 10 years earlier than non-Hispanic white women. But there is some good news in all of this. The good news is we can manage our risk factors for heart disease and stroke by living a heart-healthy lifestyle. And because this event is all about health and wellness, we do not want you to be sitting the whole entire time we're together today. So this morning we have some special movement breaks. We are joined by Running Medicine Zuni liaisons, Josh Kaderna and Tara Wolf from the Pueblo of Zuni, who work at the Zuni Youth Enrichment Project. ZYEP promotes resilience among Zuni youth so they will grow into strong and healthy adults who are connected with Zuni traditions. They will lead some stretching activities to help reduce some stress. So Josh and Tara, take it away.
Good morning. My name is Josh. I work at the Zuni Youth Enrichment Project, and I have my supervisor here. I'll let her introduce herself.
My name is Tara Wolf. I work here at ZYEP as well. We're part of the Running Medicine crew through Zuni, so we're excited to be here with you guys. Very blessed again to have a space and opportunity to do a warm up and welcome. Just getting the movement, the heart going. As my background is, I am a health educator that is really passionate about bringing education to our community to help reduce, risks of heart attacks through healthy eating and exercise. So today we have the opportunity to do a movement break with you all. So we have a couple of things lined up. I'll have Josh go over what the cards are that we'll be presenting, and we'll get y'all moving, okay?
So when we first went into lockdowns at the beginning of the pandemic, we wanted to make sure that we were able to support our youth in moving while they were at home. And we worked with the local elementary school and we worked with a local traditional artist to create these exercise cards based on animals and Zuni language commonly represented. So we have things like stretches based on the mountain lion, Hoktidasha, on the coyote, Suski, on the eagle, Kiakela, and on Yadoki Adachi, the sun father. And so we've used these a lot since we've been involved in the schools. We use them with our running medicine program, and we're going to use them today with you all. So we can connect some of these local traditional values with movement, because it's really important that we're doing this from a place of care.
So good. I am happy to see you guys. Kashay, Sarah, hello, Colleen. It's really good to see y'all here. And so pretty excited. We're gonna go ahead and do again some warm-ups for you guys. So if you don't mind, I can't see y'all, but I'm hoping that everybody would get out of their desks. Again, to help reduce stress, to keep our heart happy and healthy, we want to get moving. So I'm gonna pull a card and we can do the activity.
All right, we have Shumakaloa as our dragonfly.
Okay.
So these stretches that we're starting with, these are all dynamic movements. If you're not familiar with what that means, it's stretching through motion rather than just holding a pose. And that's really good to help warm up the muscles, especially if you haven't been moving very much recently, because our muscles are a lot like rubber bands. And so we want to make sure that we give them a chance to be ready to move. And that's what these motions are. So for Shumakaloa, this first one, it's very slow pace. If you need to hold on to something next to you, that's completely fine. What you'll do is you'll grab towards your ankle and try to pull that up towards your hip. If you're not able to get that high, that's completely fine. It's all about what you're comfortable with, and it shouldn't hurt when you try to do it. So we'll just pull that up, set your leg down, and we'll do that about, what do you think, Tara? 5 times on each side?
Yes, let's do 5 times. You guys good?
All right, we'll do 5 times on each side. So I'm going to start with my left foot. I'm going to count it off in Shurima, the Zuni language. Terry, you don't have to count it. You can judge me on how I count.
Let's do it together. Let's do it together. No judgment here, right?
Okay, and Dobinde, 1. Queely, 2. Ha'i, 3. Awide, 4. Upde, 5. Halfway there. Dolikia, 6. Queelikia, 7. Hylikia, 8. Denelikia, 9. And Assumption, 10.
Ooh,
Great, Terry, you can pick the next one that we do.
all righty. How you guys feeling? That was a little bit tough, right? Yeah, trying some balance in that one. Yeah, so we kind of struggle a little bit.
Okay, the next one that we do, this is Kushi, our prairie dog walk. This one's a little bouncy, so I would suggest if you think you may need to hold on to something to support yourself, a chair, maybe just have your hand on a wall next to you, maybe have your hand on your desk, that'll help. But the way this one works is you try to balance onto one leg and see if you can reach towards the ground. And it's not about reaching the ground, it's about just giving yourself the opportunity to move in this way. So the full motion, if you're able to go towards the ground, is picking up that back leg and keeping it straight, reaching down. I'm not very flexible today, so I probably can't make it to the ground right now without falling. So if you need to hold on to something around you, go for it. Tara, do you want to lead this one?
Sure. Again, if you can, again, listen to your own bodies. Again, we're all different. Some of us are capable, some of us listen to your body. Don't fall over, make sure you have enough space. Good job.
Okay, I think we,
I think we lost Zuni. Why don't we go ahead and move on and see if we can pick them up for our next movement break?
are they back? They might be back.
Oh,
Nope. Okay, I think I'll probably just move
Yeah.
on.
yeah, let's go. We'll hopefully by our next movement break, we'll have a better internet connection.
I was getting into it too. I noticed someone said, I'm not wearing the right pants for this. Me either.
Yeah.
I'm wearing a suit, but I was making it happen and I did need the table to hold on for some of those stretches. All right, thank you, Josh and Tara. Our first speaker will be providing some context and insight to help us understand some broader factors that impact holistic wellness of us as Indigenous peoples and communities. T. Benally, MPH Dene, and White Mountain Apache is a research coordinator with 7 Directions, a Center for Indigenous Public Health at the University of Washington. So please welcome her to the virtual stage. If you have any questions for her, just type them into the chat and we will get to those after the presentation.
Great. I think you're on mute, Royal.
Sorry, I had my camera off there, folks. All right, I got it together now.
Okay, sweet. No worries. All right, I'm going to start sharing my screen. So, are you able to see my second screen, everyone?
Yes, we can. Thank you.
Awesome. Okay. All right. Welcome, everyone. It's so great to see, well, virtually kind of see you all. But, thank you to Zuni for getting us started and getting us rejuvenated for today. I feel pretty good. So hopefully we have your attention. My name is T. Benally. I'm from the University of Washington with the 7 Directions program. I'll be presenting to you all the Indigenous determinants of health. So before I go into the content, I want to tell you all why this matters to you. So this is basically brand new research. We're doing, as they say, building a plane as it's flying. And so I'm really excited to share it with you all and for you to see the applicability of this content to you and your community. Before I go into it, just a quick introduction. So I am Dene, I'm Navajo and White Mountain Apache. My clans are Twitchitni, Nishle, Sitnajini Pashishching, Lane, Dashachedo, Kiani, Dashanale. So I just want to welcome everyone. Hello, relatives, my Dene out there. I want to throw a quick shout out to my project team. So I want to recognize and acknowledge all their hard work. So much effort had went into this content. So I just want to throw them an acknowledgement, first starting with our director, which is Dr. Myra Parker. You might know her. We have Dr. Christina Ore, and then my other research coordinator, which is Darwin Largo. So, always want to throw flowers where they're needed. So I want to gauge your initial knowledge of what maybe you know or don't know about social determinants of health. So I'm going to throw into the chat and I'm going to stop sharing for a moment. It's an everywhere poll. So I'll throw it in the chat, and what you'll want to do is copy and paste that link into your web browser. And once you do that, once you click enter, it'll take you to a screen, and on that screen, you'll be able to be directed to an everywhere poll. So if you could just do that for me, and then I'll start sharing my screen again, and you should be able to see my screen. So let me share this real quick. Just want to gauge where everyone is at. Okay, so the question is, do you know about the social determinants of health? There's no right or wrong answer. I just want to figure out where everyone is at. We got some yeses, no's, maybes. That's okay. I'm gonna let this go on for a couple more seconds. I just want to see where we're at in the room. Cool. So it looks like a lot of people know what SDOH is. That's awesome. We got some no's and maybes, so hopefully you'll be able to learn a little bit more from this presentation today. All right, so I'm gonna stop sharing there, and I'm gonna stop that poll. So keep that that URL handy, because we're gonna do another everywhere poll next time. All right, so I'm gonna share my screen once more again. All right, wait for my slide. Okay, so this is, we're gonna dive right into the social determinants of health. So the social determinants of health, like many of you probably already know, is the environment people live, work, and play. And so I like this diagram because on the top we have different, as you'll see my mouse, there's different social determinants of health. And then in the middle, we have some examples. And then at the bottom, of course, is life expectancy and outcomes. So I'll focus on a couple of examples, such as maybe something neighborhood and physical environment. So that could be anything such as housing, parks, walkability. And what I mean by walkability is think about your environment that you live in right now. Do you all have sidewalks or certain safety measures for you to get out and be active in a safe way? We have food, such as food security or access to healthy options. Are there programs available for you and your family or yourself to be healthy? And then at the bottom, we have, you'll notice the end result, which is the overall health and well-being of an individual, such as yourself or community. And this is particularly proved to be true during the peak of the COVID-19 pandemic, and it also could be true for other health conditions. Something to note is that due to factors such as poverty, lack of access or healthcare, stigma and racism can also be underlying contributing factors to health inequities as well. So I won't spend too much time on that because basically what we want to know more is about the indigenous determinants of health. And so we'll jump right into that. I have another everywhere poll, but for the sake of time, we're going to go through this, but rest assured, we'll go through one more everywhere poll at the end. But before we go into the content, I wanted to start off with this quote by Dr. Twyla Baker. And so it says, "We have children to raise, elders to care for, languages to revitalize, sovereignty to exercise, dances to celebrate, bloodlines to honor, rights to assert, water to protect, lands to love, seeds to cultivate, medicines to propagate, and lifeways to love." I think that's a really good segue into what I wanted to talk about today, which is indigenous determinants of health. So as we learned, there's various factors that can be considered social determinants of health, but this model doesn't accurately account for or reflect for the uniqueness of each tribe and important components. So I'll walk you through these ribbons quickly. So in regards to indigenous determinants of health, there's other influential factors that may also be included in your health outcomes. So we have indigenous knowledge, and this can be everything from frameworks and models and research. We also have language and identity, and this falls along such as lived experience as a Native person. So for example, earlier I included my clans and identity as a Diné woman. So also thinking about what that means to you, to all of you with your own identity. We have land and kinship, so such as your community, which can influence the impact you have on your health. We have sovereignty, such as the autonomy and authority your tribe has to govern themselves. So understanding the role tribal leadership has in your health. And then we have structural and systemic factors, such as access to resources and other things to consider, such as historical trauma. So it's important to mention historical trauma because it's such a topic that is more so true for Indigenous populations. So basically, historical trauma, as we might already know, is the multi-generational collective experience of emotional and psychological injury in communities and its descendants. And this could be trauma from anything such as relocation, genocide, or the abduction of youth to government-funded boarding schools. And so from this, we'll see the health impact, which could look like the breakdown of traditional and Native family values, the increase of alcohol and other substance misuse, also post-traumatic stress disorder, which we know as PTSD, or other signs of mental health, which could align with depression, anxiety, or suicide. However, while it's important to note factors such as historical trauma, the Indigenous social determinants of health model is an opportunity to flip the deficit approach and recognize that current social determinants of health frameworks and models do not adequately speak to histories and lived experience of Indigenous people. And so from this model, we like to come from a strength-based strength-based approach and see the health from it. So activities that we have are like ancestral teachings. So think about your traditional stories in your community and how that can encourage you to be more healthy, have a healthier life. We have the incorporation of language. And then from this, you'll see the impacts such as a positive health impact, or also this is community-based. And so that's really important. And I apologize if I'm going by so quickly, but we just have a limited time together. And so if anything that you can remember, it's just take action part. So now that you know the basics of what Indigenous determinants of health is, what can you do at an individual level? So one, you're already doing it. You're increasing education, so access to events such as this, and so raising your awareness and those in your community. And then also maybe thinking about your health regimen and incorporating things such as traditional healers, if you do choose to do that, or community capacity building. And I'll touch on that more once we get to the community level. And then the final, self-reflection and care. So at an organization level, in particular, the Indigenous determinants of health matters for the Go Red for Native Women event, for example, because it continues to encapsulate how distinct we are as tribal communities. While we can all resonate with the understanding and the importance of the Indigenous knowledge, culture, and kinship, this can all mean something different for everyone. Which is the reason why we must continue to incorporate this type of framework in our future health prevention and intervention programs and policy making. So that's very important at the organizational level. So considering what that may look like for yours. Now, finally, the community level, as I mentioned, it goes back to education and advocacy. So back when I said how community level connects the individual, thinking about the advocacy component and the engagement with policymakers and tribal leadership. So for example, growing up on the reservation, I wanted to be more healthy, for example, so I wanted to get outside and go for a run, though that wasn't always possible. So being primarily raised by my grandma, she would keep me inside, and it wasn't because she didn't care about my health, but mostly it was she cared a lot in regards to it's dangerous outside, you might be taken, there's res dogs, all kinds of different things of why I couldn't go outside. And that may be true for a lot of folks in this room as well, not having access to trails or a space to be healthy. So maybe thinking about those conversations, coming together, building that advocacy, and also speaking with tribal leadership. And so what that may look like for your community to increase maybe healthy activity. Great example that I see now in the community is running medicine. So you can continue to use those as examples. So in closing, as I mentioned, if you only remember one thing today, it's that while Western medicine will oftentimes attempt to make a diagnosis and provide care at a level that mostly looks like a one-size-fits-all model, this is not the case for Native communities. We are filled with an abundance of lived experience, cultural knowledge, and practices, and so this should also be reflected in type of healthcare and programs we receive. This is an invitation for any tribal communities or health departments interested in evaluating our Indigenous social determinants of health training. So as I mentioned, I'm at the University of Washington. So if you're interested in learning more about this or getting your communities trained in this, please feel free to contact our coordinator, Darwin Largo, or if you feel more comfortable, please contact me. So we have one more everywhere poll. And so basically all I want to do is gauge your interests in our Indigenous determinants of health community for your community or program. And if you just found this information helpful. So I'm going to stop my share. And if you just, so I'll type in the link one more time. So if you just click on that link, similar to last time, we're going to go through one more activity with our everywhere poll. All right, so let me share my screen one more time. All right, so the question is, how likely are you to incorporate the Indigenous determinants of health into your community or program? And this is completely anonymous, so whatever you all think in regards to, looks like we got a high percentage, that's really great, and very likely, somewhat likely, unlikely, that's completely okay too. This is just for us to gauge an interest in this program. Like I mentioned, it's brand new research, and so we definitely appreciate that.
And then finally, my next everywhere poll would be, so if you just stay on that link and refresh it, it'll be how interested, what would you be interested in a training related to learning more about the indigenous determinants of health? So I got a lot of yes in the room, so that's awesome. I didn't scare anyone away. Hopefully I was able to motivate you all. That's awesome. Okay, so from that standpoint, that's great. Let's see. So one more time. Hopefully I'm not making anyone dizzy on your side. Just want to wrap up and say, yeah, thank you everyone for engaging in this presentation and going through those everywhere poll. I hope I hear from you all, and if not, have a great day, and this is an awesome event. I'll hand it back to you, Royal.
I didn't see any questions, but I had a question. I don't know if you want to talk to me a little bit about the training, like what that is, like what it entails exactly. I think that might be of interest to some of our guests today.
Yeah, so the training, so just to give you some background, so our organization is working with the CDC. And so basically, we've created these modules with our site in Tucson at the University of Arizona as well. So it's a collaboration, and basically these modules will go through CDC approval, and then we'll go through a pilot study. And so with interested tribal communities or health organizations, we'll be able to contact you and it'll probably be a several day event in regards to going through the modules together, but also evaluating, like, do you all think it's helpful? What could we add? How could we improve it? And then from there, hopefully it'll become a larger project. And it's a completely, I'm sorry, one more time, it's a completely free training. So I just want to emphasize that in regards to our training.
That's a good point. So we do have a question from Sarah. She's asking, how do you make sure that you are addressing the SDOH in the community, that you are finding out the needs?
Yeah, so if you want to think about the social determinants of health, just for me to like give a better visual, I'm going to share my screen so we can look at what the question is about. So these are the social determinants of health, and based on the community or organization you're representing, you want to look at the various factors. And so say, for instance, you're working within a clinic, you want to look at food. So if you want to look at food, you'll coordinate with your program, the appropriate program, to understand maybe are there access to healthy options in regards to being more food secure. A great example, I'm not sure if it's still going on now, but a great example in the Navajo Nation, they had a collaboration with the COPE program. And so the COPE was able to partner with the health clinics there to provide different food vouchers for individuals, and they would get access to like fruits and vegetables. This is going to be, and this is a very like long term, but just understanding that, you know, the regimen that we might have been prescribed in the past is all you have to do is eat healthy and exercise, and then you'll be a healthy individual. That's not always the case. There's other things to consider, like economic stability. That's a big one. You know, income. Are people, it's not the fact that people don't want to buy healthy foods. It's oftentimes we hear, well, I, have a larger family. It's easier to buy foods that are sustainable, shelf life, and you get more out of it. And so just understanding, there's a lot of components that go into what make a person or community healthy.
Great. I don't see any other questions. Anything else that you want to add to me before we move on?
Yeah, just thank you for allowing me to speak with you all about this research. I know research oftentimes has a negative stigma in Native communities, but just recognize that, the research, as long as it's collected by us and housed by us, we can continue to make those healthy choices and prevention programs and policies for Indigenous populations.
Great. Well, thank you. All right, let's get moving again. We're going to bring back Josh and Tara from Running Medicine with another activity break. So I'll let you two take it away.
Hey, hey Josh, can you hear us?
Hi there, we can hear you now. Sorry about that. Our internet has been a little rough this morning.
No worries, no worries. Welcome back. Ready to move a little again and move a little bit again.
I think we're all connected. We're going to go into some of the other categories that we have with these cards because we have them broken up by dynamic movements, arm movements, leg movements, floor-based things, static stretches. So Tara and I are going to run through some different ones this time. Let's see here. Tara, which ones do you want to start with?
Let's go with the lead.
You got these two. Okay. So the first one we're going to start with here, this one is Mula, the parrot, and it is just a standing squat. With the squats, go down as far as you are comfortable with. If you have any challenges with your knees or with your lower legs or anything, just trying to get some movement and keeping your back up is really helpful just for getting your legs warmed up and keeping the blood flowing. If you're able to go lower down, then that is awesome. We invite you to go lower down. So Tara, how many should we do this time?
Let's do 5. And if you're in your seat, what I always like to do is so I know like if you guys don't know, I also teach you well. Some of you know who I am, but what we do oftentimes is if you need that reference point, take a chair. If you're in your chair, you like whoop, pop that backside up into the chair. And that's how often we can do it when we're sitting in our jobs doing work. We need that break. Get up and do some squats. So let's go for, what did you say, 5?
Let's say 5.
Okay, let's do 5 of those. So again, get up on your seat and join us. I'm gonna use my reference.
All right, ready? Go, all right. The next one we're gonna do is Kiakali Eagle. I'm sorry, I mixed that up. Where'd lunges go? Oh, I lost them. They're in here somewhere. I can't find the card because we're a little scattered at the moment. Oh, we'll do this one instead. This is another type of squat. This is like a jump squat. We call them rocket blast. Work this. Biggest intention there. Again, it's not about getting low. This one's about getting a little off the ground more than anything.
Cool. Okay, ready?
We'll do 5 as low as you're comfortable going, as small or big of a jump as you're comfortable doing as well.
And if you're sitting by your chair, make sure to push that chair away so you don't pop off of it. Okay, ready?
And 1, 2, 3, 4, and 5. Awesome. Terry, you want to pick the next one?
So again, we always want to have some kind of representation. So my clan is Yato Kakwe. I am a Sun clan. And I want to do is the star jumps. Again, whatever ability that you have, it's up to you, listen to your body. But what it is, again, it's the same thing. So a lot of movement here. Taking it down, whoop, and popping it up, just like the sun. So doing our early morning squat jumps. And there's star jumps. Ready? We'll do 5.
All right.
Okay.
Ready? Go. Awesome. We'll do one more.
How you guys feeling? Good?
Silence as gold.
Let's do
All right, this last one, these have been a bunch of more like active jumping ones, trying to get your blood pumping, your heart flowing. This last one is Dona, turkey, ski jumps. Again, you can keep them really small. You don't even have to jump or leave the ground fully if you feel like that is something that's not going to work for your current condition or anything like that. But ideally, you find a spot to the floor and you're just going side to side across that spot. If you're just shuffling your feet across, that is wonderful. If you're doing a full hop, that's wonderful as well. Tara, how many should we do?
Let's do 10 of those.
All right, we will do 10 of these donut jumps. So ready and go be there. Go be there. Go be there. Stand up. And that.
You can do some Josh, do some Zumba, you guys.
That is our 4 activities for your movement break.
Hey guys, we have some questions for you if you're willing to take a few moments, Josh and Tara, to answer. Can you hear me? So a lot of people, give me a thumbs up if you can hear me. Can you guys hear me?
We can kind of hear you. It's a little muffled.
Okay, so a lot of people wondering where they can get those cards.
How will we be able to get the cards? So we mostly just use these with our students in the elementary school here or during our summer camp. And we bring them out when we work with our running medicine groups in the evenings and everything. But we've actually run very low on how much we have left. Because we've handed them out to hundreds of the students at this point, and we haven't made more recently. We had these printed from a local community member. So we would, if we wanted to get more, we would have to contract him again.
We
Okay.
might be able to, sorry, we might be able to build it in as a resource page. If you check out our website, zyp.org, we have a lot of resources that we're working on getting up there. So we could
So
possibly add that.
ZYP.org, right?
What's that?
We do have this as a poster version as well that has gone up in classrooms.
Okay, all right, some other questions. A lot of people curious how they can get moving while sitting at their desk at work all day.
Oh, movement for sitting at the desk. That is a great question. We don't have a lot of cards centered on that right now because this was originally used for PE with our elementary students. But we can take a look at how to modify these to better serve that for the next movement break that we have.
Okay, and then also maybe in the next movement break, some people are like, if I have knee issues, how can I still get some movement in? So that might be a next thing to focus on.
Yeah, we'll use the chairs for the next go round because there are ways to modify. We'll definitely pull the chairs out so me and Josh can have you guys follow along that way. These movements were really high energy and I understand any problems. So we'll definitely modify the next round for the chair. Yeah.
So we'll see you next time. In a little bit here. Thanks, guys. Okay, so let's move on now with our program. We just want to give a big thanks for the support from Western Sky Community Care, a longtime supporter of the American Heart Association. We are again able to bring you an important part of having a healthy heart, which is eating right, such a big part of our lives, right? So it is so important that we eat right and take care of our bodies with heart healthy foods. And our presenter knows how to make food that is good for you and is also delicious. So that's a winning combo. So Tina Archuleta is a member of the Jemez Pueblo and owner of Vitality Plant-Based Foods. Tina has exemplified traditional values in her business as a native entrepreneur, from advancing tribal and food sovereignty to uplifting healthy eating as a form of self-respect. Archuleta continually returns to her core values when sharing to the Jemez Pueblo, where she got involved in community farming, gardening, and harvesting, as well as selling fresh food at the farmers market. Her passion and pursuit of holistic health led her to the New Mexico School of Natural Therapeutics in Albuquerque, where she studied living foods and therapeutic massage. After graduating, Vitality evolved organically and through deep care and focused attention. In late 2022, Tina opened her first brick and mortar location in the 19 Pueblos district of Albuquerque. Vitality is the first plant-based food establishment owned by an Indigenous woman. That is really cool. And in achieving this monumental goal, Tina has direct experience seeking capital through investment and navigating through the westernized systems designed to access capital. So take it away, Tina. Excited to see what you're going to make for us today.
Greetings. Thank you for having me. I'm really honored to be here, honored to share my offerings with you. I'm just working at getting my camera enabled here. If the host could enable my second camera for the presentation, I would appreciate that.
Hi, Tina, are you logged in? You can use that same link to log in.
Yeah, I'm logged in. If you can see two of my names here, Tina Archuleta. I was working on my camera and the host disabled it. So I just need my camera to be enabled in order to do this presentation. Okay, let me just work at this for you guys. Okay, perfect. Thank you for that. So today I wanted to show you all how to make coconut whipped cream. And this dish is really special because it only includes 3 ingredients and it's 100% cholesterol free. So what you would need for this dish is full fat coconut milk, powdered sugar, or maple syrup if you're avoiding sugar. And any maple syrup brand is fine. And then I have some vanilla extract. And what you want to do when you get your can of coconut milk, you're going to put it into your refrigerator and it needs to chill overnight. And what happens when we do this is that the fat separates from the liquid and you just have full fat. So I'm going to put this into a bowl. I'm being very careful not to pick up any of the coconut water underneath the fat. I don't know how well you can see that, but underneath all of that is water, liquid, and you can reserve this to use for something else, for a smoothie, for a curry, anything you want to add it to. So now what we're left with is just the full fat of coconut. And I'm going to add a cup of powdered sugar, and it's up to you if you want to use maple syrup instead of this. It comes out sweet and you really can't tell the difference. So now I'm just going to add a dash, maybe a half teaspoon of vanilla. And we're going to whip this. I like to use a hand mixer just because it gets in more air into the mixture. If you have a standing mixer, that's fine. I just find that the hand mixer does a great job for me. So I'm going to turn this on high. I'm going to actually mute you guys because that's a little loud. Well, I'm great. So you're just going to keep whipping that approximately for like 10 minutes until it gets full of air. So what you're doing is just whipping in air, just like regular whipped cream. And this is what you're going to be left with. I got a comment that you're not seeing the screen. Can somebody verify for me that you see what I'm doing? Okay. So as you can see, this is what you're left with. It's just like whipped cream and it's full coconut. It's not overbearing with coconut. So I think if you have the opportunity to try this out. Okay, the second camera wasn't working. I apologize. I can't tell what you're seeing or not seeing here. But this is what you're left with. And if you want to come by Itality to try this, we have it every day available here on our Amaranth Blue Corn Waffles. So I'll take any questions now that you may have. And I'll turn it over back to you, Royal Day.
I just am curious, can you tell us a little bit more about Vitality, like what you guys
Totally.
serve and stuff? I'd be interested in hearing more about that.
Okay, great. So my business is all Pueblo inspired food, created plant-based, vegan, you could call it. So what that means is that we don't use any animal byproducts. We don't use milk. We don't use dairy. And what that also means is that our food is 100% cholesterol free. So you could come here, have some heart healthy food. I started this business to address the health disparities we see in Native community, the heart disease, the high rates of obesity, mental illness, and I just wanted to make an impact on that. We are located across the Indian Pueblo Cultural Center on 12th and Manal, right across the entrance of the Cultural Center next to the bank. I myself became plant-based 18 years ago to just for health reasons, and I just wanted to return what I learned back to community. So I created all these dishes based off my love for my own cultural food. And that's what makes Vitality really important, is that we have culturally relevant plant-based food that isn't going to hurt our community members, and it's only medicine. So we stand by food is medicine, and we believe that we impact our own health with how we eat. And I truly believe that every day is a front line, every meal, every plate. So what you are putting on your plate, you're either feeding the health of your community or hurting your community, because each of us is an integral part of our community, especially the women. We're doing the shopping, we're doing a lot of the cooking, we're doing the feasting, feeding community. So it's really up to us to learn how to incorporate dishes that are going to be less harmful to community members. It really hurts to see in community when you're at a feast table and there's no food that is inclusive of everyone's health needs. So I just would like to see everyone incorporate healthy, fresh foods more into our diets, into your feast table. Yeah, sorry, I could go on and on.
We have a couple of questions, or one question.
Okay.
So someone asking, if you have a family who's kind of resistant to this new age type of eating, if you will, I'm sorry, I don't know if that's the correct term. Like, how do you navigate those conversations?
Right. So for me, starting off by not explaining it as a new age thing and explaining it as an indigenous way of life. Plant foods are not new to indigenous people. We have cultivated these foods for thousands of years. So I like to frame it that this is our cultural food, and also providing culturally relevant food to people. Like we have Indian tacos here, we have enchiladas, we have tamales, but it's all plant-based, and it's all about just swapping out ingredients and creating things that they love with plant-based ingredients. For example, this whipped cream, you'd be able to put it on your waffles, put it on your banana split with dairy-free ice cream, and if they do recognize there is a difference, it would be for the better, and they would recognize that it's better, it tastes better, you feel better. So I just like to frame it like that, and to create foods that my family already loves, but in a plant-based way. And we're in a time now where there's so many options out there that you can, for lack of a better term, veganize or italize any dish that you love. So that's what I would do for them. I would italize, veganize a dish they love, and go from there.
Are you guys open like breakfast, lunch, dinner, or what's?
We are open from 10 to 5, Wednesdays through Sunday, and we serve breakfast all day.
That's great. Okay, I'm coming to your place. What should I get first?
Great.
Recommendation.
Everything is amazing. Everything is special. Everything is medicine. Depending on where you're at in your journey, we have things that are sugar-free. We have things that are wheat-free, gluten-free. And we have things that we have like fry bread. So some people avoid fry bread. We'll direct you to like a feast bowl or a bowl of stew. But everything is amazing. I have a hard time recommending food. It switches from one customer to the next. So
Well, I
yeah.
really enjoyed the presentation, and I can't wait to try your place out. Thank you so much, Tina.
Totally. Thank you so much.
Okay, so we're gonna get moving again. And we're gonna welcome back Josh and Tara for another movement break. And I'll just turn off my camera and let you guys do your thing.
Okay, welcome to our last movement break. Tara and I planned out some adaptive movements that we're gonna do just from the chair, so no one has to stand up for this round. Tara is gonna take the lead on demonstrating what these look like, and we're gonna make sure y'all can see us.
So we have an inclusive program. Running medicine is for everybody. So we welcome all abilities. In SUNY, we are very like family oriented. We have a lot of families coming out. So to get y'all moving, stay in your seat, make sure you have clearing around you. We're gonna start off with some toe touches. And so we're gonna alternate toes, I guess. Feet. Yeah, feet to hand, okay? And so we're gonna do 5 each. Ready?
Ready?
So ready and go. 5, 4. So each one is a pair, right? 3, 2, 1. Last one. Whoop.
My bad, I can't count.
It's okay. So that was the toe touching.
We have some toe reaches. So for this one, you're just gonna have your feet out straight in front of you. Try and keep your legs straight, and you're gonna reach up, and you'll reach down towards your ankles and your toes as far as you comfortably can from your seated position. Tara, how many do you want to do?
Let's do an even number 6.
All right, we're gonna do 6. We'll count Shima for this one. So
So
very
good.
good.
Nice and slow.
we copy. Okay. Last one. So
So oftentimes, again, we do have something called Zumba Satao. So we have a seated based Zumba program that we also work with. We are going to do some chair crunches. Listen to your body. Again, we're gonna grab the bottom of our seat. We're gonna kind of push our bottoms a little bit to where we're comfortable. We're not falling over, but this is gonna get a little bit hard. And again, listen to your body. If you can only pick up one leg at a time, that's cool. Josh here is gonna do like full on crunch for us. And we're gonna try to do, let's do 7 of these.
7, all right.
Ready? Okay, so get comfortable, make sure you're in position. We're gonna lift our legs as far as you can go. Don't hold your breath, make sure to breathe, okay? Here we go.
Oh,
Don't forget. Wheelie.
Copy. Good. Copy. So
Don't forget.
there we go.
Did you guys like that one? Again, you can alternate too. If you're just barely getting back into exercising, listening to our body, getting that heart rate up. Oftentimes we work with the elder community too, and this is a great way to get their heart rates going. And so listen to your body, take it as you need to be. What was the last one?
The last one is really similar to what's called a Russian twist. So you just need to sit tall in your chair, your back kind of up. If you have something to hold, if you need to make this a little more tougher for you, that's fine. Otherwise, we're going to start with our hands together, and you're going to kind of reach around to the back side of the chair on opposite sides of you. And if you keep your hips and your knees kind of still in place, it's all coming from your midsection that you're twisting this happening. And how about, since this is a bit more lighthearted on the body, we can do 10 of these.
Yeah, let's go for it.
All right, ready? And double dip,
Okay.
wheelie, copy, following dip, double kick, wheelie kick, high kick, then I lick you, a step shot. That's that. And then we have one stretch that we're gonna end on to help you all relax for the rest of your presentation today.
Okay. So for this one, I just kind of like you guys to take a minute, re-ground yourself, close your eyes. Take a deep breath in. Release it. One more time, in. Go ahead and release that breath. So in the mornings, like we had good intentions set this morning, saying a prayer, we often get out and we greet our Father, Son, we get the Pietachu with prayer. And so this morning, again, graciously being here, having the opportunity to share with my sisters here, the Indigenous sisters, having our Indigenous brother Joshua, he's been with ZYP for a while, joining us and leading ZYP in running medicine. I want to just say a prayer today, gratitude, reaching up to the sky, thanking our Yathakadachu for the day that we have here, taking that arm movement back down, again, keeping those eyes closed, breathing in, lift those arms up. You're breathing out, take those arms down. Our time, breathe in. One more time, breathe out. When you're feeling that stress and momentum coming up from work, taking the opportunity to have a 5-minute movement break is important. Not only to like our health, but the stress also really influences our health. And I think we have opportunities, sometimes not as much as we want, but if you take that time, go around, get some fresh air, enjoy the Father, Son, enjoy everything that we have around us, taking that opportunity again to realize that you're important. Taking care of yourself is important. Running medicine, again, we're part of that here in Zuni. And I just want to give a shout out to Anthony Flegg and Shannon Flegg, who, are the founders of Running Medicine. And their program starts on 3/26, right?
25,
26, 25 and 26 in Albuquerque. And we have our program on Zuni coming up as well.
Yep.
In April. And so again, thank you guys for the opportunity. Remember, taking care of ourselves is foremost important than anything else. You matter, your health matters. We have to take care of ourselves in order to take care of other people. So taking the opportunity just to have a moment of, winding down, exercising, and I hope you guys really take this opportunity to enjoy the day and reflect on the Indigenous women that we have here, our Indigenous family.
Thank you so much, Josh and Tara. I love how you guys showed us how to work at our desk, or get moving. That's like so important because so much of our day is spent sitting down at a desk. I appreciate both of you.
Absolutely. You all have a good rest.
All right, so I'd like to introduce our next presenter, who is going to share with us information about the connection between our hearts and our minds and how important it is that we take care of both. Karen Wakanda Lewis, Laguna and Isleta Pueblo, is a public health practitioner. Today, she's going to help us access our given gifts to connect and create and maintain balance in our hearts and our minds. Especially during challenging times, we need to really reconnect and be reminded of calling on these gifts to regain our balance again, which is a clear path from heart to the mind. And when that happens, our body is at ease. So please welcome to the virtual stage, Karen Wakanda Lewis.
Well, good morning, everybody, and thank you. I appreciate you being here. Oh gosh, heart and soul. This is the number where I can be reached, or the email if you have any questions or further contact. I want to talk about a little bit of the heart and soul, and if you could show the next slide, please. As you know, our heart and soul has a strong purpose, and it really began at the initiation of the conception of when we were conceived, where the sperm hit the egg, and that had the first fire, and we call it the spirit fire. But that spirit fire lives really in the heart, and so through intentions and through mindful activities, we can ignite it and we can reach our soul purpose, our passion. What is our passion? And sometimes throughout life, I know in my livelihood, I lost a lot of, what was my sole purpose? Maybe due to grief or due to changes in lifestyle. But I always had to come back and remember that fire ignites passion, and we have every way to control and work with that fire. If you look at the picture has a heart. And I want you to remember that every part of our body, but specifically the heart, generates geometric designs and geometric patterns. And this is how we relate to food, our breath, our thought, engagement with others, and really having the beauty and bringing it back into our space, our heart and our mind. So when we're in joy or when we're in laughter, really reflect on it, really bring it in. I know at times in my life when I was so busy, when my child was really young, and it's like I had to do, and I forgot to really stop and take a moment of hearing that laughter and really feeling it in my soul, in my heart, and seeing the beauty of such joy being shared. And so if I want to take you this practice of mindful aware, and I want you to just sort of sit in your chair. If you're sitting, if you're standing, both, either way, I want you to really plant your feet onto Mother Earth. And knowing the house or the office or the building that you're in is directly in contact with Mother Earth. Now, you know that Mother Earth provides every single nutrient for your body, and particularly your heart. And just allow that connection to be from Mother Earth into your legs and into your heart, and really being thankful and gratitude for all those gifts. And as the presenter said earlier, just grateful for the morning, seeing the morning sun, just being here, being present, your body, your mind is here. And all the gifts of the presenters that they brought. May they have wellness and beauty in their life as well as yours. We'll go to the next slide, please. So the heart, I like to think of when we're healing the heart, I like to look at it as an elements. So we just did a practice with Mother Earth. It coincides with the heartbeat. So drums, in our ceremonies, if you could just meditate with the drums and bring it in. Sometimes we need a reminder, and drums provide a shake up. It shakes us up in the heart, in our body. It gets us back in rhythm. The earth element reflects to the sound element of Om. Om. And if you could say that now to yourself and really build that vibration down to your heart. Om. And radiate it into your chest. This really gets the vibration back and set with your heart, physically, as well with your mind mentally. Now, we're going to talk about the water element. And sometimes this is left out with the heart elements, but water is a transporter of blood and nutrients. And as we saw with vitality, it's so important that you get good nutrients to your heart. I'm also a nutritionist, but I took it for granted a lot of times because of the lack of time preparing meals. And it wasn't until a friend of mine and I said, you know what, let's get back to the basics again. Let's get back to what Mother Earth has to offer. And by doing that, we're bringing gifts to our heart, to the heartbeat of all, and sharing that with others. So, take in good food. The good food like rose hips. Roses is the highest frequency. And so by drinking rose tea, rose hips is really beneficial to the heart. Making sure they're plant-based because that the vibration of Mother Earth comes in. I tend to make sure that the foods are non-GMO and organic so that they can be very clean and healthy. I try to eliminate processed foods because over time, the energy of that food just gets lost. So you want to make sure you have very healthy foods to your body. I want to start doing hydroponics, I don't know if I'm pronouncing it right, but, growing it indoors to where you have, water, praying on the water and just putting it on the plants so that you grow plants and herbs without even the soil, so you can bring it inside. And wouldn't that be great? We had the fire element, and the fire element regulates the beat. And so it regulates whether that frequency of heartbeat is going to be high or is it going to be low. And this is what we see with the high blood pressure, the precursor or the risk factors to heart disease is regulator of heartbeat. And a lot of times it comes with emotions and mental health. And with that, I want you to get your hands. And what we're going to do with all the elements involved, we're going to massage the fingertips of each, because each fingertip represents an element. The fire, the lung element, the liver element. Liver holds a lot of fire, and it holds a lot of anger, and it holds a lot of high emotions. So you want to make sure you eat healthy foods also for the liver, so it doesn't get overheat up for the heart. And also you want to try, we'll go into mindfulness and other activities for the mind, but right now let's just massage. We're going to massage the fingertips of your pinky 7 times. 1, 2, 3, 4, 5, 6, 7. Go to your ring finger. 1, 2, 3, 4, 5, 6, 7. Middle finger. 1, 2, 3, 4, 5, 6, 7. The pointer. 1, 2, 3, 4, 5, 6, 7. And your thumb. 1, 2, 3, 4, 5, 6, 7. Do to your other side. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. And on the pinky, 1, 2, 3, 4, 5, 6, 7. We're going to bring the palms together, and inside we're going to massage that important part. 1, 2, 3, 4, 5, 6, 7. I did this with my little granddaughter because we went to the ranch yesterday and she was so active. She was so full of excitement. And then pretty soon it got a little bit too much to where like she was mimicking a little bit of anger. So we were playing this game. I spy with my beautiful twinkly eyes, and we would name the color. Well, then she started saying, I spy with my Ming eyes. And she would name something, and so I knew I need to calm her down. I knew it was going to react energetically to her heart. So I said, okay, why don't we take a break and let's just massage your fingers and pointing. And she loved that. So we started counting. And so that's a good exercise to maintain and balance all the elements in your body. Know that these are connected to your organs. And so in closing it with the palm of your hands back and forth. So that's a great exercise to do. Next slide. So the practice you take in order to maintain a healthy heart is bring awareness to healthy, alive foods. My grandmother and my grandpa made sure that we had healthy, alive foods. And then my mom started planting a garden. And then now I'm starting a garden. And we were talking about that with my granddaughter yesterday. What kind of garden are we going to plant? What can we plant and take care of? And she was naming all the vegetables that she wanted to have, and making sure that then you can them or properly store them. So that they last, throughout the winter, instead of buying canned food or things that are not alive. So bringing those healthy, alive foods and joining them, making sure that, like my grandma would say, sing a song when you're planting, put your heart effort into the seed and wishing it well. When you're watering, take care of it and just be really happy about it and saying thank you. So I'm making sure from the start, my little granddaughter, my grandson, when they take a bath, thank you, water, Dawaya, thank you. And they're saying it in their native language so that they start that awareness, because knowing that that water also comes to your heart. We're going to pause a moment and become mindful for each awakening moment. And this exercise and the next exercise really regulates your heart rate, your heartbeat. And so what you want to do is just sort of take time out in your moment of the day to pause and have an awakening moment, just in the moment. And that means either with your eyes open, but it helps with your eyes closed. And again, with your feet planted on Mother Earth, or making sure your sit bones are on your cushion. Just sit, first of all, with the awareness. Calming the body down. Calming the mind down. Making sure your back is erect so that your top of your head can meet Father, Son, and all the star nations. Make sure that there's a connection there. And we're just going to follow the in-breath, only the in-breath. Being aware of when it comes in. Do this a couple times with the in-breath. And then we're going to include the out-breath. And if any thought comes in your mind, just note it, just thinking, and let it go, and come back to the breath. Good. If you take this activity throughout your day, it really helps to connect your mind and your heart again. Sometimes I do this a lot when there is disputes or situations that I'm fearful of. And I'll just okay, Karen, just stop. Feel your breath coming in and feeling it out. Because I don't want to go on habitual patterns. I want to stop the mind. And I want it come back to the heart space. Because when we start running with our mind, our heart becomes really hardened, or it can be very sorrowful. It can take on like a sponge to where you take on others' pain or anger. You just want to make sure at those special moments that you just take time to step back and come back to yourself, get grounded again. The other exercise is allowing the air element to calm your heart. And the good one to do is just knowing that when you're walking, or when I'm in the grocery store, or when I'm driving, I take those special moments be aware of calming, calming. And then eventually I become aware of calming for others' well-being. And I then become less impatient. I become more open to all beings, knowing that the trees are also taking the air element. Having compassion for all beings. So when you practice compassion, you're getting into that heart space that we'll talk about next. Next slide. So ground yourself throughout the day, walking meditation, feeling the lifting, planting, lifting, planting. And that was the intention of our ceremonies in dancing. Somehow we have forgotten it, but that is the intentions of lifting and planting, getting grounded again, making connection with our Mother Earth, using essential oils. I use essential oils a lot. In fact, I use them every day. But for my heart, I end up using grounding oils, vetiver, rosemary, cedar, and I put it in a carrier oil. And I often put it in like jojoba oil or organic olive oil. It needs an oil to carry into your body, into your pores of your skin. And I apply it. The good places are right here, the carotid arteries, behind your ear bones, on your wrist, and just spread it over like this, or in the soles of your feet. Vision deep red colors. And I wore red for that because it's a reflection of your heart and your blood. And imagine that it's coming from your soul. So you're imagining, and you can close your eyes and just imagine this red, deep, deep red color coming from the sole of your feet, connecting to your soul purpose, S-O-U-L, and going to the first fire that you were born with, conceived with. That's when you had your soul agreements. So that's called root meditation. The other one is healing your heart of pain, suffering, grief, and heartache. And that is so important to do. And the essential oils are rose, lavender, blue tansy, spruce. And you can get those in your garden or naturally in a herb store. Spruce is really, really good because I know in our Pueblo dances, we're given spruce, for a lot of our dances. And that really goes to our heart, that the smell of it is purposely used for grief and suffering and heartache. And if you, put it in your hand, the live plant, and just smell it and hold it, that will go directly to your brain automatically, instantly. Another one is holding a rose quartz. I made a necklace with rose quartz, and I just make sure I put it near my heart, being aware of it, holding it and meditating with it, and imagining it and coming into your body. A green emerald or green color. I use rose water. You can make your own. I remember making it with my grandmother, but making it or buying it and then spraying it on yourself throughout the day. But this meditation is really good. Breathe in 4, 1, 2, 3, fold, hold for 8. If you can't, then hold for 4, but hold for 8. So let's redo it again. And then you breathe out 8. The most important part is breathe in 4, breathe out 8. So breathe in 4, hold 8, 5, 6, 7, 8, breathe out 8. 1, 2, 3, 4, 5, 6, 7, 8. And as you breathe out, let go of that grief and suffering and heartache. One more time, breathe in 4, 1, 2, 3, 4, hold 1, 2, 3, 4, 5, 6, 7, 8, breathe out 8, 1, 2, 3, 4, 5, 6, 7, 8, and let go. Next slide, please. I want you to recognize the beauty surrounding you. It is everywhere around you. And during suffering and during pain, just take a moment. And if you don't have that in front of you, then close your eyes in your mind's eye and picture yourself smiling at that moment when you found yourself most happy. You know, it may be when you were a child. It may be remembering your grandmother or grandfather's hand or your mom and dad's, you know, some moments like that, and just bring it back in. When I work with children, when we were working with children at a school, I had to just stop them. And I said, okay, let's just focus on your breath. Calm your breath down. And I'm going to feel your pulse. And we're going to put an essential oil on your wrist. Just calm down, lavender. And I want you to smell it. Breathe in 4, hold, breathe out 8. The important thing is meeting your soul and taking care of your soul with your mind. You have to do that every day throughout the day. And if you have enough awareness, then start sharing with others to calm down, to generate love of the beauty of all beings and welcome it inside of you. So thank you so much. And I take any questions that you have. If we have time. So again, if you like more information about essential oils, just give me a call because I think they're so important. Oh yes, I do offer our services for retreat, and that's when we're adding artwork with meditation. So we just had one with mandalas, and we're doing one with Santo Domingo right now, next Monday, Pueblo, where we go into mindful practice. And then we paint our mandalas. They're wooden mandalas, and we do this with children. The next one we have is Mommy and Me, and you can look on Dreaming Crafts. It's March 12th. And I partner with Dreaming Crafts, DREAMING crafts.com, and we're having Mommy and Me. So that's open to grandparents, or we had a widower, a male with his children, or we had an uncle and niece. I mean, it's a time to when you're connecting with children. So we do a lot of mindfulness activities with artwork. So that's March 2nd coming up. And we have a lot more coming up with food and meditation and meditation with art. So thank you so much.
Hi, everybody. Can you guys hear me or see me? I got kicked off and I'm trying to go through my cell phone.
I hear you, Riel.
Okay, can you guys?
I
don't know. Can you guys see me at all?
Yes.
Okay, good. All right, just making sure. Okay, thank you so much, Karen. That was really awesome. I felt like for the first time in a while, I felt completely relaxed in the middle of the day, and it made me realize that I need to do more of these exercises. So I appreciate it. Okay, so next we have Chantel Ballard, Oklahoma's Community Impact Director for the American Heart Association, to teach us a quick and easy skill that can save a loved one's life. Chantel?
Hello, everyone, and thank you for joining us today. Of course, my name is Chantel Ballard, and I'm the Oklahoma Community Impact Director. One of our main priorities is to teach the life-saving skill of CPR to at least one person in every family across the country. We know that approximately 350,000 out-of-hospital cardiac arrests happen each year within the United States. And of those cardiac arrests, only 46% of people actually get CPR. This percentage is even lesser for women because of our anatomy and people's fear of actually hurting us in the process. We also know that it is more likely that you will have to perform CPR on a loved one rather than a stranger. But in either case, we want to make sure that you guys are prepared in case of an emergency. Now, this demo will not serve as a certificate, I'm sorry, I'm messing up. It will not serve as traditional CPR, but we do know that hands-only CPR has been proven to be as effective as CPR with breaths in the first few minutes of out-of-hospital sudden cardiac arrest. So if you see an adult or teen collapse and stop breathing, these are the two important steps that you need to do. Number one, and I'm going to back up so you guys can see my mannequin. Number one, we want you to call 911. Number two, we want you to do chest compressions. Now, when you are doing chest compressions, we recommend that you do them at 100 to 120 beats per minute. Now, commonly a song that we use is Staying Alive by the Bee Gees. But one thing that I want you guys to do right now is to actually feel your own pulse by taking your 2 fingers and on the side of your neck, actually feel how fast your heart is beating currently to see how fast you should be going when you are doing chest compressions. And so with that, to do effective chest compressions, take the heel of your palm, place it in the center of the chest, take your other hand, interlock it with your other hand, lock your elbows, and lean in to use your weight to push as hard and fast as you can. Now, if you have someone else with you, it is best that if you're in a public place to have them identify where the AED is and bring it so that they can do the shocking. And you will continue CPR until you have professional help there to take over. And it's just that simple. Thank you guys for watching this demo.
Thank you, Chantel. It's so important. I feel like I could always use a refresher on how to do CPR. So I really appreciate that. And it really makes me feel better just as a mom that I have those skills. So thank you again, Chantel. All right. So earlier we learned about the connection between our brain and our heart. And for the last presentation, we're going to learn about the connection between our mouth and our heart and how having a healthy mouth can help us have a healthy heart too. Lieutenant Commander Lisa Begay, DMD, is an enrolled member of the Navajo Nation. She has 18 years of experience in dentistry. Begay started her career as a dental hygienist in 2004 after graduating from the University of New Mexico with her bachelor's in dental hygiene. She worked for the Indian Health Service before attending and graduating from A.T. Still University, Arizona School of Dentistry and Oral Health with her Doctor of Dental Medicine degree in 2014. Begay accepted her commission in the United States Public Health Service in 2015. She currently serves as the Chief Dental Officer at the Quinancito Band of Navajos Health Center in Tajali, New Mexico. In 2022, she received the Albuquerque Area Dentist of the Year Award for her outstanding clinical performance and leadership skills. So please welcome to the virtual stage, Lieutenant Commander Lisa Begay.
Good morning, everyone. Can you hear me?
Yes.
Yes.
Okay, sorry, I can't get my video working. I'm like the least tech savvy person ever. I'm like, I can't control my slides. I don't know how to blur my background. I can't get my video on. I'm sorry. I spend most of my time in clinic and not online. So anyway, so let me just start my presentation, guys. Okay, so I'm Lisa Begay. I'm a dentist. I'm doing my topic on the link between oral health and cardiovascular disease. So let's see, go ahead and go to the next slide. I believe somebody's controlling it for me. Okay, so the objectives that I want to teach you guys today are for you to understand that oral health is related to systemic disease. I want to explain the association between oral inflammation, specifically gum disease, and cardiovascular health. and improve patient education between just like understanding the relationship between gum disease and cardiovascular health. Go ahead and next one. So I'm sure that some of you have heard the saying that oral health is the gateway to overall health, which is an accurate statement, as you'll soon see. So the oral cavity is composed of a diverse group of millions of microorganisms known as bacteria. Oh wait, go back to that slide. That live in your mouth. They live on your teeth, your gums, your tongue, your saliva, and they play an important role in your oral and systemic health. So poor oral health has been linked to various diseases such as cardiovascular, diabetes, and brain health. And I'll only touch on a few of these. So I'm going to talk a little bit about diabetes and some of the Alzheimer's disease before moving on to the cardiovascular health. So with individuals that have gum disease and diabetes, the inflammation that is produced from the gum disease can make it more difficult to control blood sugar and can increase A1C levels with diabetic patients. And then the relationship between the gum disease and Alzheimer's disease, the oral bacteria can cross the blood-brain barrier, and it's been found in the brain tissue of people with Alzheimer's disease. And the oral pathogens can cause inflammation in conjunction with the beta myeloid proteins, which form plaques and can accelerate Alzheimer's disease. So as you can see, there's a reoccurring theme, which is that inflammation is caused by oral pathogens coming from your mouth. So I'm going to dive into the topic, but before I do, I'm going to go over like what gum disease is. So just bear with me. You're going to feel like you're in a dental lecture, but I'm going to go through a couple of slides related to gum disease, which is this slide right here. What is gum disease? So as you see the slide on the right-hand side, it's a little bit blurry, but you'll see along the gum line, there's a sticky substance called plaque right there. It builds up, along the gum line in between your teeth, and it's has like millions of bacteria in that sticky biofilm called plaque. It starts inflammation, which kind of makes your gums bleed, makes your gums puffy. It first starts out as what's called gingivitis, which is reversible. And if you clean it off, if you brush and floss, maybe you see your hygienist, it's reversible. So you could get back to healthy gums. But if you don't clean it off, it eventually, goes into gum disease, where you'll see the picture on the left side where you lose a lot of bone around your teeth, and eventually your teeth will get wiggly and they'll fall out. You'll lose a lot of bone around your teeth. So essentially you will, have a lot of open wounds, which will have like harmful bacteria can enter your bloodstream. So go ahead and go to the next slide. So what are the risk factors for getting gum disease? So I used to be a hygienist before I became a dentist. So of course, number one risk factor is poor oral hygiene. So just the lack of brushing and flossing. I see a lot of patients day in and day out who just don't brush and floss very well, or they just don't come and get their teeth cleaned, and then they, have a lot of bone loss, a lot of teeth that need to get fixed. So just make sure that you're, doing your job at home, brushing and flossing and coming to get your teeth cleaned. Otherwise, you'll end up in this category of having gum disease. Another risk factor is age. 70% of patients that are 65 and older have some kind of gum disease. Smokers are at higher risk to have severe gum disease compared to non-smokers. Genetics is another risk factor. A small portion of people have an inherited genetic disorders to have early or aggressive gum disease. Stress makes it more difficult for you to fight off infections. And then other systemic diseases may worsen the condition of your gums. And then poor nutrition and obesity. Just a poor diet can lower your body's immune response and make it harder for you to fight off your infection. Okay, next slide, please. And then there's the prevalence of gum disease and periodontitis. If you go to the dentist and they say, you got periodontitis, it's just gum disease. It's a fancy dental word for gum disease. So, so gum disease is the 6th most prevalent disease affecting humans. In the US, if you're 30 years and older, there's 38.7% have mild to moderate gum disease. And then there's also 8.9% have severe gum disease. So in total, half of the US population have gum disease. So that's pretty significant amount of people. And I read something interesting that the CDC considers periodontal disease or gum disease a worldwide pandemic. And then if you're kind of wondering, I looked up the American Indian Alaska Native population, 35 years and older, 17% have severe gum disease. So that's twice the national average compared to everybody else. So it looks like we are far worse off than the national average. And then we have some of the poorest oral health outcomes than any of the other ethnicities. And that could be to we have a higher poverty rate, we have lack of oral health knowledge, and we have barriers to dental care. Okay, next slide, please. Okay. So now we're getting into what the cause of the link is here. So researchers have found that harmful bacteria associated with gum disease migrates from the oral cavity to distant sites of the body. So how does the bacteria get from the mouth to other parts of the body like the heart? Go ahead and go to the next slide, please. So it's an inflammatory disease. So the inflammation plays a major role in gum disease and cardiovascular disease. The inflammation process starts with bacteria building up around the teeth and in the pockets. So when I say pockets, you'll see the tooth there and you'll see that little yellow stuff kind of pouring out and going into the artery. That's just saying there's a pocket right there with that red area by the gum. So that's a pocket. When you go to the dentist, they might say, oh, you have pocketing. So that's what I mean when I say pockets. So anyway, so if you have buildup and stuff with bacteria, the bacteria hides in those little pockets. And that's what I'm saying. You have buildup around the teeth and in the pockets due to poor oral hygiene. So anyway, over time, when the gums get inflamed, they form ulcerations within the pockets that allow harmful bacteria through to the bloodstream. And then the harmful oral bacteria then can travel to the arteries and then they bind to the vascular walls. And then your immune response kicks in and it releases like phagocytes, which are like an immune cell that tries to kill the oral bacteria by binding to the infected cells. And then over time they die and they start creating like a blockage or almost like clutter within the artery, which is almost like the first stage of atherosclerosis. So damage occurs in the artery walls and that promotes the artery plaque formation. And then the process continues kind of like in a loop with chronic gum disease. And then arteries become narrow over time, reducing blood flow. And then over time, clots can develop and then a heart attack and a stroke could occur. Okay, and then go to the next slide. So with these studies, I just looked up a couple different studies. So the study number 1 is basically just saying like you have buildup of plaque in the arteries is higher for gum disease. The second one, it said study number 2, lack of brushing and flossing has been linked to changes like buildup in the arteries, basically by having poor oral hygiene. And then study number 3, let's see, getting gum disease under control reduces inflammation. So basically with all of these studies, the takeaway message is if we can treat the gum disease, then we can reduce overall inflammation in the body, and this can play an important role in the prevention of cardiovascular disease. Okay, next slide, please. Okay, our role in patient education. And when I say our role, I feel like all of us could probably, take on this message, whether it's dental or, whatever specialty you guys are that are on this conference call. I mean, we could all, let our patients know that they need dental exams every 6 months. They need dental cleanings every 6 months or sooner. And I say or sooner because people that have gum disease, their recalls, they need to come in either every 3 months or 4 months, depending on whatever the dentist or hygienist decide they need to come back sooner. And then gum disease or oral disease is silent until it gets significant enough to cause pain. And I see this every single day with emergency walk-ins. A lot of people walk around with a lot of abscesses and they don't even know it, or maybe even dental caries like dental cavities or even gum disease, and they have no idea until the teeth start getting wiggly, and they don't know it because it doesn't cause pain until the day that it does. So by keeping a regular schedule and coming in every 6 months, we can catch things early before they become a problem. Go ahead and change it to the next slide, please. Okay, so working together. I believe interprofessional collaboration is very important. So just all of us working together with medical, dental, other departments to improve patient health outcomes, coordinating with each other to create an effective care plan to achieve better patient outcomes. Would be great. I know where I work at in Cañoncito, we have medical, dental, diabetes, all of us kind of collaborate together. And that it's helpful to have like a team all together in one setting where, if somebody has diabetes in medical, and they can just kind of refer them over to dental, or if I see somebody with high blood pressure, I'll send them to medical. Okay, next slide, please. References. Okay, next slide. All right, that's the end. Any questions?
I don't see any questions in the chat. We will wait a few moments just to see if that changes.
I can't hear you.
Sorry about that. I was just saying thank you for the presentation. I think we all forget sometimes how important it is that our mouth health is we're taking care of our mouths because it's connected to every other part of our body. So I really appreciate those reminders. Thank you so much.
Yeah, thank you.
Well, you're welcome. Well, living a healthy lifestyle, of course, is all about balance, and you won't always be able to eat that perfectly portioned or low calorie dinner or lunch, hit the gym every day, get a full 8 hours of sleep, but you can just make little choices, do little things every day that'll make a big difference. As we all know, it's up to us to put our health first and to take care of our heart health. So again, we can take care of everybody else. As I mentioned earlier, I think as women, we all tend to put our signs that there's trouble in our bodies aside because we're multitasking and doing so many other things. So let's remember to put our health first and do little things that we can do, just little tiny things that'll make a big difference. We really hope that leaving this seminar, you'll share the things that you learned today with 5 other women. So after you log off, whether it's a coworker, one of your family members, a friend that you'll see this weekend, just talk about some of the little things that you learned about vitality and the food that they serve there, or dental checkups, how important it is, or maybe show them some of those exercises, right, that we learned today that you can do even just sitting at your desk. We really want to spread the Go Red for Women message throughout New Mexico because it's just so important. We will be sending out evaluations and a resource kit to all registered attendees. So you will have these tools that we need to incorporate some of the things that we learned today in our daily lives. And to close out our 10th annual Go Red for Native Women Heart Health Summit, let us welcome back Shaye Lucera with our closing blessing.
Dawa, thank you for bringing us together to remind us the importance of heart health. In Pueblo Grandismo medicine, we're taught as health practitioners, healers, to know that the heart is the main organ we are reminded to take care of in ourselves, as well as in our clients, our patients. And as we have been taught about the importance of being heart healthy by everyone today, we also need to practice our own self-care and learn to listen to our bodies, our symptoms, and the practice of listening to yourself may save your life. So Creator, please surround all the attendees in love, continued health, filled with peace, laughter, and blessings. Kumet to the women, Hachsemet to the men. In the Western Kara style language, the rough translation is, may you have the strength to go forward in life. Drury shots until we meet again.
Thank you, everyone. Have a wonderful weekend, and we appreciate you joining the summit this year.